Hello everyone, I'll be uploading a series of video lectures on the ECG. In these, I'll be discussing about the basics of the ECG, the ECG leads, determination of the axis, the heart rate, various conduction abnormalities, interpretation of the ischemic changes on ECG, and various other clinical abnormalities that can be interpreted from the ECG. Starting with the basics. So what is the difference between electrocardiogram and electrocardiograph? Electrocardiogram is basically the measurement or the graphical representation of the electrical activity of the heart, while the machine that is used for this measurement is the electrocardiograph. Certain cardiac cells basically possess a property known as automaticity, by virtue of which they can spontaneously generate electrical impulses, and hence they are known as pacemakers. If we take a look at the process of the depolarization and repolarization, here you can see there's a cardiac cell where in the interior of the cell there is negative charge and outside there is positive charge. We call it a polarized cell or the cell in the resting state. Then when stimulus is applied to the cell, there is an area of depolarization that is generated, which is known as the stippled area. And then when it progresses, it leads to complete cell being depolarized, and the state is known as depolarized state or the excited state. And then it can once again return to the polarized state once again by the process of repolarization. If we see the direction of the depolarization and repolarization for the entire myocardium, the direction of depolarization is endocardium to epicardium, while that of repolarization is opposite, that is from epicardium to the endocardium. Discussing about the basics of the ECGs, the waves, intervals and segments. Here you can see basically the P wave, the QRS complex, the T wave and the U wave. The waves and the complexes, if we add the segments, that is PR segment, the ST segment and TP segment to them, we call them intervals. Like you have the PR interval, which includes the P wave and the PR segment, and QT interval, which includes the QRS complex and the ST segment and T wave. The normal duration of the PR interval is from 0.12 to 0.20 seconds. That means 3 to 5 small boxes, while that of QRS complex is 0.08 to 0.12 seconds. That is 2 to 3 small boxes. When the QRS complex ends and the ST segment starts, this is known as the J point. And the duration of QT interval normally is 0.36 to 0.44 seconds. If we see the basic ECG graph paper, so we can see there is a large box, and in each large box we have multiple small boxes. The measurements of the large boxes, in the x-axis we have 0.20 seconds, and in the y-axis 5 millimeters correspond to 0.5 millivolts of voltage. While as in the small box, one small box in the x-axis we have 0.04 seconds, while as in the y-axis 1 millimeter corresponds to 0.1 millivolt. So how do we determine the heart rate? The basic formula is 1500 divided by RR interval in small squares. Like here you can see between the two RR interval, you can have 1500 will divided by 5 small boxes that are here. So the heart rate would be 300 beats per minute. Here you have 10 small boxes, so you'll divide 1500 by 10, you'll get 150 beats per minute as heart rate. Likewise, 1500 divided by 15 would be 100 beats per minute here. Okay. We can also use the formula 300 upon RR interval in large scale, but it's not accurate because sometimes complete large boxes are not there. This RR wave can fall here also, so we need to calculate the small boxes that are between the RR waves. Okay. Likewise, if we have a RR interval in large scale is 1, so heart rate would be 300. If 2, so it would be 300 divided by 2, that's 1500, and likewise. One important thing that's to be noted is the calculation or corrected QT interval determination. You have three formulas. You have the Bézet formula, that is QT corrected is equal to QT upon under root of RR. Then you have the Hodge formula, that is corrected QT is equal to QT in milliseconds plus 1.75 times heart rate in beats per minute minus 60. And you have the Framingham formula, that is QTC is equal to 0.154 times 1000 minus RR.